Hi everybody, I'm Susan Collini and welcome to our monthly roundtable. As we get Ronnie all settled in here. He's the one behind the scenes and in front of the scenes. So today, we haven't seen you most of the summer. We had a couple of misses here and there, so we're back on track. So welcome everybody. Let me introduce our team. This is Ronnie.
Hello.
Ronnie, tell the camera what you do. I always introduce it. I'll let you guys introduce yourselves.
I work on the office side with Doctor. I'm also a scrub in the OR and pretty much everything else in the building when it's needed.
Especially IT. Like he's fixing computers, all that good stuff. But he works with our patients too for a lot of time. Does a lot of wound care too. Yeah. Yes. And to my right, your left, Derek. Derek, tell everybody what you do.
I'm the director of our laser center here, and I work with pretty much all things skin. Anything that you have to deal with skin, hair, products, I'm your guy for it.
That's it. And, well, I'm Susan Collini. As you know, I'm the administrator here, and I guess chief cook and bottle washer, as they all like to say.
Keep us all
but
together.
I just try to keep us all informed and educated, and as well as you out there watching us. So to my left, your right, is Suzanne. Suzanne, please introduce yourself.
Sure, my name is Suzanne, and I am a licensed electrologist, so I deal with all things excessive hair removal. So if you've got anything like that, I'm your girl.
And then on our end here is Ashley. Ashley, introduce yourself.
Hi, my name's Ashley. I'm one of Doctor's office nurses, so I also work with Ronnie on Tuesdays and Thursdays. And then I also am an esthetician down here. I also work with Derek too. So I mainly do more facials, microdermabrasion, some chemical peels, laser hair removal, and cool sculpting. So all your skincare needs, I am here for you too.
Yeah, that's it. So, team, today we're talking about what everybody knows about October, Pink Breast Cancer Awareness Month. So, one of the things that is important in our practice, not that we are the general surgeon that a breast cancer patient would see, and we're not the general practitioner where it's going to be the screening, the scanning, that determination. People come to us once they've been diagnosed and have been referred to some type of reconstructive procedure. And so I'm actually going to let Ronnie talk about some of the reconstruction we do, and I'll chime in if I think I could add something.
Yeah, of course.
And go ahead, Ronnie.
So after somebody's gone through a mastectomy and they're hopefully cancer-free and all those things, that's when you come to see us next, and doctor's going to assess you and look at your options for breast implants, fat transfer, different things. We're going to see how much tissue you have there to work with. Flaps, latissimus dorsi flaps to, make everything fill out the proper way and have enough tissue in the area.
Look better.
Yeah,
and
of course.
That's an important thing to
I mean, that's why women really do want reconstruction, is they still want to feel like women, and sometimes, and that's not to downplay any woman out there that chooses not to have reconstruction. That's certainly a badge of courage, I'd have to say. But for those women that feel that this is an option for them, or this is where they'd like to go, that's what we do. And so we've had many patients over the years go through this process, and most of the time most patients have been diagnosed for a very they've beaten it, or they're cancer free, and that's a good thing. Sometimes we have to see them again. Breast reconstruction isn't always a finite procedure, especially if you're having implants involved. Implants can have some issues over the time. So some patients we've seen more than once over the years.
Of course, and they're always happy, and we try our best to give them the best appearance they can have and make them happy, of course.
And we try to tell patients, and even if you're not one of our patients but you're interested in the topic, one of the things, reconstructive breasts don't look like what patients see when they want to just have breast augmentation. It's not quite the same thing. So patients should really do their homework so that they're not afraid, they're not scared. They know what they're getting into before they do it, because there are many different things. You and your doctor should talk about how you want to be reconstructed and what the realistic end results are going to be, because sometimes that's a little bit traumatic as well.
Of course.
Is there anything, Ashley, that you'd like to add because you're in the office at all?
Yeah, so too, I mean, just doing like self exams on yourself at home too, like if you're in the shower when you're changing every day, just kind of feeling around the breast area to make sure there's no like foreign lumps, just keeping an eye on that. Like once a month is a good time to assess, or just any time you're showering is a good way to do it too.
So patients are really their own advocates, and especially in this day and age, I don't like to say that, but our healthcare system isn't quite the way it once was, and it's getting harder and harder to be able to see clinicians and professionals. So you really do need to be your own advocate, your own self, your self-proponent. You do this with self-care and be aware of it. And anything that you think is abnormal, don't poo-poo it. It's better to try to push getting that appointment and making sure that you get your mammogram, your annual mammogram. I'm not quite sure what the regulations are with your insurance companies because they do have limitations and things like that, but
I think it starts around 40, correct?
Right.
Yeah.
And they change, and each insurance company changes. We always like to try to use the regulations that Medicare puts out because that was the standard at one time. Unfortunately, a lot of insurance companies are making their own standards. That's unfortunately not something I can control or any of us here could control. So just be mindful that you have to ask those questions and how long they will allow you to do that. There is an end time when they won't pay for breast, mammograms or whatever. And you might need an ultrasound, you might need a CAT scan, you might need an MRI, you might need other kind of tests that determine whether you have breast cancer. And sometimes patients actually have to go for a biopsy. It's not just determined, maybe the x-ray or the image shows something, but we really have to get a pathological determination about what that is before going forward. But we're here, and we hope to help patients, get to the next part of life. And one of the other things that we do here, which is kind of interesting, and sometimes patients undergo, when they have their mastectomy, they actually have the whole nipple and areola removed as well. It just depends on the type of cancer, how aggressive you want to be. Again, your general surgeon will determine that with you or review that. But once that tissue is lost, it's, it does make the breast look differently. But we actually have a great cosmetic tattoo artist that can do 3D nipple areola tattooing, and we can show you pictures or go on our website and you'll see those images to see how realistic they are, because they are amazing. So I think that's a great thing. Anything else about just the testing and the things and the procedures that we do?
The only thing I was going to add is patients don't often think about this, but even with breast reductions, when we're taking off all that breast tissue, you are seeing a reduction in your chances for breast cancer down the road because we're taking out that tissue. So.
Okay. We do. That's a big part of our practice. We do a lot of breast reductions. There are a lot of women with very robust, size breasts, and they want to have them reduced, and that is covered by insurance. So that's a good thing that we see.
Just a little tip there.
Right. And I'd like Suzanne to chime in because she has a little anecdotal, personal story about.
Sure. I think it's so important, especially for women, to know their family history and to share that family history with your general practitioner, because then the general practitioner, if there is a need, can actually order genetic testing. And once you have the genetic testing, then you know if you're more predisposed to breast cancer or not. And then you can get on a track of imaging and on a regular basis, so that if, God forbid something does happen, you're testing much more regularly, that they can, detect it earlier and things like that. So just the importance of being as proactive as you possibly can be, and especially mostly after 40, just staying on top of your regular mammograms is just so critically important.
So Suzanne brings up an interesting topic about genetic testing, and we're talking about the BRCA gene, the BRCA gene, and that became very popular with Angelina Jolie. I think it's been 10 years already that she, did her prophylactic mastectomy. And for those of you that don't know what a prophylactic mastectomy is that possibly you have this BRCA gene, which means you are at a much higher risk for breast cancer, and you don't have breast cancer at the moment, but you choose to prophylactically have your breasts removed and reconstructed. So that is something that we do. We have had patients that have gone through that procedure. And, again, it's a discussion with you and your general surgeon first, or your primary physician and your family, and then you come to us and we can work out the details of how that gets into the plan. But know that women are doing it and it is an option. Anything else, Spence?
I think we covered a lot there.
Okay. So, not to diminish it, but I know we've had this conversation on breast cancer multiple years now, because we've been doing our roundtable since 2020. I can't believe it. Yes. So lots of years. So we're going to veer off topic now, and there's side topics because they still have to do with patients that may have breast cancer, but this could be anybody. So I know that one of the things that we see with any type of cancer patient that's going through any chemotherapy, radiation, or anyone that's experiencing hair loss. We're talking about, I'm going to let Derek chime in here on the things that we can do to help with hair loss, and then we'll talk about a couple of other things that are anecdotally tied into these patients.
So, I don't know if you're following our videos, you've seen in the past that we do carry Nutrafol, which is a natural supplement that really helps to invigorate the hair growth, and they've had a lot of great clinical studies with that. So when you're doing something that kind of has your hormones under attack, like undergoing treatment, or a lot of the chemotherapies and drugs that they use are really tough on the hair. So obviously with asking your physician, that is something that you could use to either kind of bounce back from the hair loss, or to kind of help prevent some of it while you're undergoing treatment, again, if that's something that they could blend with your treatments. And then
you might have to wait until
you might have to wait until your
therapy's
therapy's finished.
So just be aware of that, because we're not trying to supersede your.
That's right. Yeah, as I said, we're not trying to supersede that for hair loss, but if you need to support it, you can. And then we also have our own formulated minoxidil, which helps with topical application, especially for male pattern hair loss. And then if you do have an issue where you end up losing enough hair that it's not coming back, we do Smart Graft in this facility, which is an FUE, a follicular unit extraction, which is something that I actually had last December on the front of my hairline, because I was seeing a little bit of thinness, and it's a relatively easy procedure that's no anesthesia, it's done mechanically, and it's extremely natural.
Now look at this great head of hair.
This poof that I have on here.
Yeah.
So if you ever have hair loss that you experience to that extent where it's not coming back, this is something that we can do, and that is very popular in our facility. And also, once you're in better health, because I know when we do PRP, which is platelet-rich plasma, we're taking the blood from you, we're spinning it down, we're taking your healthy plasma, and that has all the healing and growth factors that you want to reinvigorate the scalp and reinvigorate the hair. That is something you want to be healthy for, because again, the materials you're using in your body can't have a lot of chemo drugs and things like that in it. So that's something that you would do post-treatment, but it's really going to at least give you the best chance of growing that hair back as quickly as you possibly can. I know it was something in the past that we used to work with some stem cell, and we're hoping to get some exosome therapy as well, which kind of mimics the hair follicle and can actually regrow an entire follicle instead of just invigorating that scalp in those areas. Duplicates it. So we both have experience with that. That works very well. And one thing I wanted to touch on with the post-mastectomy is doing scar revision for their so with a lot of surgeries that people undergo, especially with the breast, there tends to be a lot of scarring, and also with the breast reductions, because it's the way that the surgery is done is pretty much always the similar scar. And one thing we can do is we can really help improve the appearance of those areas non-surgically in an easier environment than in going through surgery, either lightening them, fading the scars a lot, or one thing we see a lot of is sometimes when they're healing, it's a little bit knotty, and people will feel a lot of pressure and a lot of tightness in the breast, and we actually can use our radio frequency device to help alleviate some of that
Right.
tissue tightness that people
break
feel,
up that because it's a little
and
scarring.
break it up and make it a lot more comfortable. And we work on all portions of scarring, whether it's pigmentation, vascularity, the knottiness or trophicness of the scar, so we can really help a patient improve the appearance of their post-surgery. One other thing that I see a lot of is that they get a lot of tattoos, post-mastectomy tattoos. I also remove the post-cancer tattoos from surgery as well, so that is something that people seek out.
That's really great. And one thing I really did want to add, in our salon, we actually have Lauren, who does a lot of our hair work. So she actually is trained to not only do extensions, but to work with hair pieces. We do have quite a few patients that suffer from alopecia and some other long-term hair loss and maybe permanent hair loss. And patients don't have to go to a full wig if it's only in partial spots or it's just little areas. And she creates custom little pieces that can go in there that are really great, and patients are really happy. They're so natural. You never know who the patients are, and they look great. And so that's another service that we can offer. We don't carry full-blown wigs in the salon. We probably would be able to have access to them, but I think patients always really want to try them on. But all these lighter type of hair restoration procedures are really much more popular than seeking an entire wig on the head, because people look more natural. It just so I think that's a great thing. So we do that as well. And I think I can't think of anything else that we can tie into what we do that might help anybody that's going through this.
No, just we talked about the hair removal. Sometimes some of these drugs inhibit estrogen, and then we're seeing people have like a similar to PCOS type hair growth in the face. So that's something Suzanne and I do, as long as it's, for me, as long as it's dark hair, but I know you cover all different kinds. So that kind of, just helps. When we have breast cancer patients that have come in, because I've had quite a few, they feel like something's been taken away from them. And that's something that we're, like Susan said, whether you choose to treat or not, you survived something, and that's amazing, but we just try to make you feel your best and give back something to you to help lift your spirits a little.
Yeah. And even too, like people going through treatments, like you're under a lot of stress, and added stress can cause more hormonal issues, more hair loss, more issues with your actual cancer that you have. But good ways to do that is like mindful meditation, doing yoga. We have the yoga studio.
Absolutely.
So if you're looking to
Exercise is
de-stress,
everything.
Exercise is really great. It's a
important
really
thing.
great.
doing some yoga, meditation, just to keep those stress levels down and you feeling a little bit better too.
Absolutely.
Absolutely, and eating healthfully is always
Yes.
mindful
It's the
that we
biggest thing.
do that as well. Don't worry, I'm not opening a food store. No,
That'll be next.
Yeah, we're all a little bit. I mean, the way we try to, we try to live what we preach here. So, and I think that shows in a lot of the things that we do. So, I really appreciate this team with me, because they bring a lot of valuable information to us as a team and to you. So on that note, we'll just do a couple of little things that you might want to know. One of the products that we are featuring for Breast Cancer Awareness Month is we have a product called Pink. We call it Pink Juice, but that's not really what it is. It's a lactic acid. So I'm going to let Derek, talk to you about that. But it's pink, so it just fits the bill.
So if you're familiar with our products, if you follow us for a while, you've heard of Blue Juice, which is our
Love the Blue Juice.
our hyaluronic acid, which these are all of our products are medical grade. They're made right here in the United States. And the Pink Juice that we've now added is actually basically like parts of our hyaluronic with a little bit of an exfoliant in it. And what that's going to do, with a little kick for you, and what that's going to do is help with textural issues, help minimize some redness, and really give the skin a lot more of a smooth texture without being such a strong acid, because some people are really sensitive to salicylics and glycolics. Lactic's obviously a milk-derived acid, and it is a lot more gentle on the skin, so it's a lot more tolerated by more people.
It's actually my go-to because I started the business with the belief in glycolics, and that was my go-to choice for myself. And I could do any heavy-duty glycolic for years and years and years, and then all of a sudden I
Got sensitive to it.
did I say that? I don't know. Anyway, I had a lot of sensitivity to it, and it just would be tearing up my face all of a sudden, and I couldn't use it, and I was so upset because I know the intrinsic value of glycolic, and it's so good. So when our lab was able to formulate this the pink juice with this lactic acid, I can finally take a resurfacing topical ointment at home without doing something in the salon or the laser center, and it works for me. So it's great. It hydrates and does that nice little resurfacing, tightening up the pores, and so I'm very happy with the pink juice.
And they're all paraben, dye-free, testing-free. Just so everyone knows, pink isn't. It's not an artificial color. There's minerals in there.
It's just really pretty.
It's just pretty looking. I should have had a
pretty.
bottle first.
Yes,
But
yeah, it's a shame. I was looking to see if we had any. We have a cabinet up there, but I guess we need to refill it and stock it because we have it all upstairs for our promotion. But anyway, we're offering 20% off on that so that you can try it. So we are, doing some little pink things upstairs to help make people aware of the importance of this month. And finally, the last thing I want to just let everyone know, I can't believe it's October 2nd.
Yeah.
So as you know, we do an open house every year, and it's always 2 Wednesdays before Thanksgiving. So this year it falls on November 20th because actually Thanksgiving is very late this year. We don't have as many Saturdays and Christmas during December because Thanksgiving is so late. It's very odd the way the calendar falls. But anyway, our open house this year is November the 20th, and I think that this is awesome. It's the only time I can really say this, but we've always had fun. We've had a little scavenger hunt throughout the building, so you really get to meet the team, see our facility, talk to us about products, services, anything that you'd like. We have little areas that we make it interesting for you to follow through the building. We have prizes. We have, food. Entertainment is us. So there's always a theme.
yes.
And so that theme, you'll watch our website. You'll see this theme coming up. So this year it's a cute theme, I think, and everybody can get into it. But one of the things that we are doing this year as the big winning, it's not a prize, the winning gift, whatever. So you have to be here and participate. Is we are actually going to do a complete laser treatment for someone that they can possibly win. And there are 2 options, and there's not one laser particularly, so whoever wins will have an evaluation as to what would be appropriate for them. And we'll customize it according to them. But that means 3 treatments of, really highly sought after procedure that you could possibly win. And so we'd like to think this is an opportunity for you to really learn about what we do and all the things that skincare and what we promote can do for you, and hopefully you'll be a winner.
Absolutely.
Anything else to chime in, Suzanne? You've been working diligently about all the promos and the social media about
there's
what's
a lot of
going on.
good stuff coming up, so just stay tuned. If you don't follow us already, make sure to follow Age of Innocence, as well as Kalini Laser Clinic. We're going to be giving a lot more information. We have 18 lasers here, so we're really going to be giving you guys a lot of good information on all the things that are offered.
Right. And Suzanne just worked out, one thing we found out in our digital world that, we do a lot of communication with all of you on our Age of Innocence Facebook page more than anything, but we do have the Renaissance Center, Dr. Kalini Facebook. We have a laser one, but they will forward you a lot of times to Age of Innocence. So if you can't remember one thing in particular, hopefully you can Google one of those things, and it will take you where you need to go. And if you really can't find us, just
give us a call.
Give us a call. We'll always get you to the right spot. So.
That's it. And our phone number is 570-674-5555. So it's a really easy number to remember in Shavertown, Pennsylvania. Anyway, I think that's it for us.
Yeah. Till next time, right?
Till next time. Till November. Au revoir, everyone. Ciao.